Hey there, Dr. Alan Christianson here with you. I want to talk about an important topic that can be difficult, but it's a big thing. And it's all about your libido, sex drive, whatever you want to call it, and whether or not thyroid disease can affect that. Now, it's an important topic because it's just a pleasurable part of life, obviously, to have a great physical relationship. It's also something that's a big indicator of overall health. When it's not right, it's not fun, but also it means something's really wrong. Something's wrong with your system. We think about things like heart disease, diabetes, blood pressure, of course, the thyroid disease being a culprit too, but it can point to hidden problems. Also, I think about how so many medications can be triggers behind that and blocking it. Antidepressants, anti-anxiety medications, sleep medications can do that as well. A survey once said that over 70% of women would not want to talk to their doctor about their libido and wouldn't want to bring it up. But it's a critical thing, so I want to talk about just how this ties to the thyroid overall. Now, from person to person, this can be different, but for some, the thyroid can have a direct effect upon the ovaries and the testicles. So the hormones they make are different when the thyroid is functioning well or when it's not. And this is just as true for those who are on thyroid replacement therapy. The other part of it is that indirect ways in which you're not feeling your best could completely impact how your libido is. If you're dragging butt to get through the day and you're exhausted by nighttime, you're not going to feel too romantic. So sometimes fatigue can be a culprit. Also, your thyroid can cause cortisol to elevate. When thyroid hormones are erratic or lacking, you may make extra cortisol to help thyroid hormones absorb across the cell membranes. Well, that high cortisol, it's a stress hormone, and that can also take away from the sex drive by just making you feel frazzled. And there's those to where if they've struggled with weight because of their thyroid, then that itself could affect just how they feel about themselves. Not wanting to be intimate or being more self-conscious. There was a case, and we think about this, there was a woman named, we'll call her Sandra, and for many years ago she saw me, and her chief complaint was that her libido was poor. This was notable because she'd been married for over 6 years, and she and her husband had been very sexually active, and that was the case for the first 3 to 4 years of marriage. And it was like a notable thing to her girlfriends. They always joked about that because she and her husband were just very frequently active. But it dropped off a lot in the last few years. And she said that it was so bad she even had to remind herself to initiate sex because otherwise she just wouldn't even think of it. One of her girlfriends told her how something like this had happened to her and that she saw one of my doctors went on testosterone therapy. That's why Sandra came in. She just wanted to go on testosterone. She thought that would help. And I told her, I said, that could be a factor. Those were valid concerns. We should make sure there's no medical issues behind that. Oftentimes, that can be a hormonal situation. I said, this is, let's check it out. And that may well be the case. But I wanted to do a full analysis of her overall health to be sure what was the culprit. And this was a good teaching example for me. Thyroid disease, there's classic symptoms we think of, the fatigue, the weight gain, the hair loss, the dry skin, the depression. But not everyone has all of them or even any of them. Sometimes there's symptoms that are less common that are the one symptom that a person has. And this was actually Sandra's case. Her test showed she had active progressed Hashimoto's, and yet she had no other common signs that would go along with that. She actually had pretty good testosterone levels, like above average. So I said, hey, that's not what you need, but we did help to really get to some causes behind her thyroid being off and address that. Helped her detox, get on a good diet for that. Within the first month and a half, her thyroid got better. It improved pretty rapidly. And she noticed that, hey, she was pretty much back to where she was in terms of her libido before it started. So I've seen examples like that to where it's a sole factor. Her case is a little more remarkable in that there was nothing else involving with it. In many more cases, it's one of the secondary symptoms of someone who does have thyroid problems. So if your libido is poor, the first step is to know that, hey, not okay. This is not acceptable. This is not normal. It means something's wrong. So get a thorough evaluation. Get your thyroid disease really evaluated. And a doctor should know what optimal function looks like. You know, I hear so many people that are frustrated about not getting good care, and they say, hey, what test should my doctor do? I'm like, well, if your doctor doesn't know which test to do, they won't know how to read the tests they are doing or the tests that they should be doing. So you need someone who's really versed in this stuff, and there's more and more of us out there. Should also get a good thyroid exam, an ultrasound, and that testing should include antibody testing, the free hormones, the reverse T3, the TSH looked at an ideal range. And then also that should be part of a good overall screen of hormones, stress pathways, blood sugar regulation, overall health. Along with that medical check, think about the psychological side of it. You know, this is huge. Think about just how healthy your relationship is. You know, how good your communication is regarding just overall needs, but also sexual needs. You know, how well can you express that? How comfortable are you in doing so? It's an important skill. Think also about your partner's libido, his or her general mood, his or her general level of confidence. These things are also relevant. And then action steps to help, you know, think about your personal self-care. You know, do you set aside time for just giving your body routine benefits and attention? Basic things about skin brushing, you know, skin lotioning, doing your beauty treatments as need be. You know, how well do you really care for yourself and respect your physical needs? Any ways you can improve upon sleep? There's so many ways by which sleep ties into the brain chemistry involved with libido. And just the most direct thing again is that when you're going to bed, if you're about to totally crash and there's no reserve left, nothing else is going to happen. You know, keep bedroom just for lovemaking, sexual play, and sleep, and nothing else. Don't make habits for watching television or reading murder mysteries or things along those lines. And another big consideration is exercise. You know, physical movement is huge for making the endorphins that allow for a good strong libido. So, is your thyroid happy? You know, you can always check that out with a thyroid quiz and see where it is, but know that your libido is important and worth thinking about. Dr. Christianson here, and take great care. We'll talk in really soon.